Who are you? What's your, really what's your superpower and why should you win this award?
My name's Hannah, and I'm the co-founder and CEO of Starling. We've developed a Class 1 toilet indwelling medical device that uses UV vis spectroscopy to scan your urine for chronic conditions every time you use the bathroom. And our first module is on the market today for monitoring the risk of urinary tract infections. So our superpower is that our product is completely seamless. It's hands-free, passive, reusable. It requires no change from our patients' daily habits. And so far, we're actually seeing our patients use our device about 3 to 5 times a day. The other part is really how we built our software and data algorithms around this technology in order for it to be more than just a wellness device. So our Starling program partners with providers and aims to directly prevent symptom escalation, hospitalization, and urosepsis. So through our Starling care team that partners with their existing providers, we're able to intervene with simple behavioral coaching, sometimes as simple as, hey, you need to drink more water. And after these interactions, we will actually see their risk score go back down and they don't end up getting an infection. So UTIs are pretty much the bane of any provider's existence, and we're here to really serve the neglected population and help prevent these infections from escalating.
So Hannah, I love the smart toilet. We've seen lots of these before, but ultimately a lot of them don't gain traction. And I know that, UTIs, you're going after a good, that's one particular application that, I think has a huge opportunity for so many reasons. Do you have an example, an anecdote already that you can share with us in that particular case?
For our device, like I said, it's toilet indwelling, completely hands-free. So we're seeing really high engagement. I think that's a tribute to how seamless it is, but also how motivated these patients are. So UTIs are extremely preventable, but they can very easily spiral if they are neglected, which is sadly the case today. So we partner with providers, and one of our providers, we helped them do a study on their treatment cost for UTI patients. And we found that for just recurrent UTI patients that go in for, urinalysis when they think they have symptoms, it's about $400 per patient per month. However, once that patient gets hospitalized for a UTI, it skyrockets to about $15,000 for that patient that month. So we had a patient with that client specifically, where our nurse got a flag from our predictive algorithm that the patient, had a high risk for an infection. This patient had previously had urosepsis, really because they would get symptoms and kind of ignore it because they knew if I try to go see my provider, it's going to take, 2 days for me to get in there. Maybe my symptoms will subside, and they actually had to get hospitalized. So now that they're on our platform, we actually saw even before they had symptoms that something was wrong. We saw they had higher components in certain areas in the urine. So we, called them, let them know through behavioral coaching, have you been drinking water? Have you been voiding regularly? What has your diet been? And we were actually able to implement some simple changes before they even had symptoms. And then later that day, when they used Urindex, our device again, just because they were going to the bathroom, we scanned their urine, we saw their risk profile go way lower. They didn't end up getting an infection. And, I can't say that we prevented it, but they didn't end up getting one. They didn't go to the hospital. They didn't get uroseptic again. So that's really where our secret sauce is that we do this loop before they even are symptomatic, because UTIs can be so prevented if you're really looking for it. And another example is just since we are plugged into providers, if they do have symptoms, again, it's not the end of the world. We can get them in that same day, again, because our partner clinicians are now not inundated with all of these potential symptomatic patients. We're kind of handling the early triaging, and we just send them over the patients that are symptomatic and that need their treatment. So we're really just reworking how these patients go through the clinical pathway so that the ones that need it go to their providers, and then the ones that we can just work with to prevent infections in the first place get the care they need.